Good morning all. I am Dr. PJ Madam Rafi. Today we are going to discuss about anti-metabolites. Okay, first sulfonamides. Okay, sulfonamide drugs are bacteriostatic and they inhibit folate synthetase enzyme. Okay, and these drugs are not effective in presence of pus. Why means the pus consisting of large amount of PABA. Okay, that's why because of there will be large amount of PABA, these drugs are will not effective in presence of pus. Okay, and the sulfonamide drugs are metabolized through liver by acetylation process. Next, these sulfonamide drugs causes crystalluria in acidic urine. Okay, that means it will cause crystals. Then main important uses of sulfonamides will be silver sulfadiazine. It is mainly used in Burns patient and fungal keratomycosis. Next, sulfadiazine. It will be used as nocardiosis. This combination drugs like sulfadiazine and pyrimethamine. This is the most common frequently asked in MCQ. Sulfadiazine and pyrimethamine. Okay, this will be used as toxoplasmosis and pneumocystic gyrovecki. Okay, in these two infections, we will use this combination, that is sulfadiazine and pyrimethamine. We have to remember it is sulfadiazine. Pyrimethamine we will know. This sulfadiazine or sulfasalazine they will give. That's why it is sulfadiazine pyrimethamine. Okay, in useful in toxoplasmosis and pneumocystic gyrovecki. Next is sulfasalazine and volsalazine. Okay, it will be useful as ulcerative colitis. Next is toxicity. What are the side effects of sulfonamides? Obviously, sulfur drugs will cause hypersensitivity. Okay, and granulocytopenia, thrombocytopenia, aplastic anemia. Along with this, it will cause kernicterus. Okay, if you give in these drugs in third prime minister in pregnancy cases, it will induce kernicterus in newborns. Okay. Next is these drugs will cause hemolysis in G6PD deficiency patients. Okay. So here main important regarding sulfonamides is enzyme inhibition and this uses. Okay. In one sulfur, it is single silver sulfadiazine. In toxoplasmosis pneumocystis gyrovecki, it is a combination sulfadiazine plus pyrimethamine. Okay. We have to remember. Next drug is trimethoprim. Okay, trimethoprim is bacteriostatic. It will inhibit dihydrofolate reductase. Okay, that's the difference. We have to remember it is different in sulfonamide drugs and trimethoprim. Trimethoprim it will inhibit dihydrofolate reductase. That is folate synthetase. Okay, that's a major difference. So next is uses of trimethoprim. It will be used as prostatitis and urinary tract infections. Adverse effects like megaloblastic anemia, leukopenia, and pancytopenia. And will cause hyperkalemia. How means by blocking of epithelial sodium channel in collecting duct. So it will be contraindicated when you are, or it will be very cautious when you are prescribing with potassium sparing diuretics. Okay. Next drug will be cotrimoxazole. Okay. Cotrimoxazole, it is most important drug regarding the combination. They will ask the most combination. It is a fixed dose FDC. It is a FDC. That means fixed dose combination drug consisting of sulfamethoxazole and trimethoprim. It is a combination of which percentage also important. It is 5:1. How to remember means first we have to remember the name sulfamethoxazole and trimethoprim. Okay. In toxoplasmosis that is different. That is sulfadiazine and pyrimethamine. Okay. Here will be sulfamethoxazole trimethoprim. Combination will be percentage will be 5% of sulfamethoxazole, 1% of trimethoprim. Okay. These are both are bacteriostatic. When these two drugs are combined, they will show bactericidal activity. It is a cumulative or additive effect. Okay. This is mechanism action is sequential blockade. They will means this sulfur drug will inhibit folate synthetase. This trimethoprim will inhibit dihydrofolate reductase. Thereby it will have sequential blockade. Thereby it will show bactericidal activity. Okay. This cotrimoxazole is drug of choice for pneumocystosis. Okay. This is most commonly repeated MCQ and nocardosis and Burkholderia cepaxia. Okay. Here main important is pneumocystosis. Okay. Pneumocystosis main important drug will be cotrimoxazole. It is drug of choice. Combination will be sulfamethoxazole, trimethoprim. Sulfamethoxazole will 5%, trimethoprim will be 1%. Okay. This is regarding anti-metabolites. Okay. Thank you.